Nakuru health workers have called off their 4-day strike after signing a deal with the county government. Now, the deal was signed during a meeting between union representatives and county government officials. Those returning to work are nurses, but doctors are, however, still on strike. The strike has seen many patients in public hospitals suffer, with some of them detained inside the public facilities because they had not paid their bills. KTN'S Kamche Menza now joins us by way of phone from Nakuru. Kamche, if you can hear me, kindly tell me what exactly were the terms of the return to work formula.
Thank you so much, Najma. So here we understand that the return to work formula was signed between the county government and the Kenya National Union of Nurses in the presence of the Kenya National Union of Nurses, the Secretary General, Seth Anyako. And the terms of the return to work formula is that the issue here was promotion and arrears, and what has that there are 1,700 health workers or the nurses who had applied for the promotion, and say that they will be given the promotion from September, October, November, December 2016, and January 2016, of which the effective date for their arrears of promotion first of July 2015. So some of the other health workers under the ESP program and the PSC list have been told that they will receive their arrears of all employees who have been promoted on the various dates, which shall be effective from the month of September 2015. So this is something that the nurses have agreed. But according to the doctors' union, they say that this is not what they wanted, and that they're still calling on for their strike, because the main issue here was the promotion, which they wanted to be dated back to the date when they were given the promotion, and that is not what the county government wants to do. So that has been the bone of contention between the county government and the health workers, and the nurses have agreed on that. Doctors have, however, refused.
Kamche, the nurses also wanted improved working conditions. Was that addressed also?
That one has been addressed. It has been one of the issues or other grievances that have been raised over a number of years for the 7 strikes that have been experienced in the whole country. And that according to the union, is not majorly the issue, seemingly that it has been addressed so far. The major issue was about the promotion, delayed promotion, and the arrears and the payment of missing allowances.
Maybe, Menza, if you could tell us what was discussed in the meeting this morning. Are you aware of the nitty-gritties?
About the nitty-gritties, not exactly, Najma, but bearing in mind that the main issue was promotion and the allowances and the arrears, then that must have been the main issue that was discussed there, because that's what had taken the health workers on strike.
Yes. And
yes.
Kamche, do you know the fate of the patients at the public hospitals? I believe some of them were being held because they couldn't pay some of the doctor's fee, the hospital bill.
So we kindly recap your question, Najma.
The fate of the patients in the public health facilities. Some of them were being locked because they could not pay the hospital bills. What is their fate right now? Will they be...
Their fate right now, Najma, I want to imagine it is the same, because in the whole of the morning, the return to work formula once the health workers go back to work by 2 afternoon. And by now, they are like that probably the nurses have not gone back to the hospital. So chances are high that the situation is still the same until the nurses are back. And these people there, they were lacking drugs, they were complaining of poor food. Most of them are the victims who had been involved in accidents, and they were undergoing treatment. But since the fact they had not received any dressing probably of their wounds, they had not, they were immovable in a way that because their legs were not visible to them. So up until now, what we will be keeping up with the hospital for 2, and then see what exactly is happening. Maybe the nurses have gone back, probably have a word from those who have been affected, and maybe tell us what they are experiencing now.
Thank you, Menza. Just before I let you go, have you managed to talk to any health worker there, and what are the sentiments of the workers?
We have not met the health worker apart from the nurses union that was in the meeting. and they were saying they're okay and they will go back to the hospital. However, there's a request from the nurses that no nurse or other health worker should be victimized. The ones who participated in the strike, no worker should be victimized after the strike has called off.
Thank you very much. Kamche Menza there telling us the health workers called off their 4-day strike and most of their concerns have been addressed.